Welcome to Conversations on Healthcare. This week we welcome Cheryl Gay Stolberg of the New York Times and Victoria Knight of Axios, two veteran health policy reporters on healthcare on the ballot in November. Now, here are your hosts, Mark Maselli and Margaret Flinter.
Americans will soon have their opportunity to weigh in on the direction of the country. The midterm elections are about 1 month away, and many experts say healthcare is on the ballot. They mean that voters will choose candidates who will ultimately make vital policy decisions about who will get care, who will receive it, and how it's paid for.
And we're excited that two distinguished journalists are joining us to discuss healthcare on the ballot. Cheryl Gay Stolberg is a New York Times Washington correspondent covering health policy. In over 2 decades at the Times, she's also covered the White House, Congress, and national politics. And also with us is Victoria Knight, healthcare policy reporter for Axios. She was previously with Kaiser Health News.
Well, we want to thank both of you for being here on Conversations on Healthcare today. Cheryl, let's start by asking you to give us your take on a recent NPR poll found that the top issue for all voters is inflation, but also that 3/4 of Democrats said the Supreme Court's decision to overturn Roe v. Wade makes them more likely to vote. This midterm is being described as a clash between inflation and healthcare. I'm wondering how you see it. Is this going to be a healthcare election?
Well, I think it'll certainly be an abortion election, a Roe v. Wade election. I think that we've seen that the Supreme Court's decision in the Dobbs case has really upended what a lot of people thought was going to be a Republican, if not a rout, certainly Republican victories in both the House and the Senate. And now that's looking less so. Democrats are really energized to go to the polls, and they are, angry and mad about this ruling, and they want Congress to do something about it. And we're going to see President Biden, in fact, talk about it just today. He's emphasizing this as a factor in the midterm. So I do think abortion will play a role, and to a lesser extent, healthcare writ large, because healthcare is always an issue. It's so important to so many Americans. So even when inflation is top of mind, healthcare is going to be on the ballot as well.
Well, Victoria, you've reported that voters in California, Michigan, and Vermont will be deciding on constitutional amendments to protect abortion access. Kentucky and Montana voters will be voting on further restricting abortion rights and conferring legal rights on fetuses. How do you think all these ballot questions are playing out right now in these states?
Well, I mean, we saw a great indicator in Kansas. They had a ballot, or they had a referendum on the ballot about abortion, whether to restrict it in the state of Kansas. That is a traditionally conservative state. Voters overwhelmingly rejected that, said, no, we do not want to further restrict abortion access or add that as a constitutional amendment. So, and there was a huge surge in women voters registering to vote in Kansas. And so I think that at least Democrats are hoping that that is going to a trend that's going to continue. So as you said, there are in several states, it's to increase access to abortion or further protect it. And in 2 states, it's to further restrict it. And so we're going to see how that plays out. The thing that's a little different is for ballot referendums, sometimes you need certain percentages of the population to vote for something, and kind of differs by state. So it's a little different because it's not attached to a candidate. And so I think that's perhaps why we saw what we saw in Kansas, which was they rejected that amendment.
Cheryl, you reported on the Democrats passing the Inflation Reduction Act and how it will let Medicare directly negotiate the cost of prescription drugs, and how this ultimately will result in cost savings. But I'm wondering if there are enough Americans aware of this development. Is there enough time? Is this message breaking through?
Well, that's a good question. Before we get to it, I actually just want to jump in and say one more thing about abortion in the congressional races. We're already seeing it play out in 2 very key races in Virginia, those of Elaine Luria and Abigail Spanberger, 2 endangered incumbents who are emphasizing abortion. Both are abortion rights. Both are running against women who oppose abortion rights. So that'll be kind of a good test in a swing state. As for the Inflation Reduction Act, I think a lot of Americans are actually aware of it. They're aware of the issue of lower drug prices. The Biden administration has just announced that Medicare premiums will go down. So a lot of seniors who we know vote in large numbers will be feeling that in their pocketbooks. And people, who take medicines that are expensive are following this. I do think that it's not as much time, frankly, as the Democrats would have liked, but the fact that they got this law passed and they took on the pharmaceutical companies who are, kind of boogeymen in the public mind, is something that they're going to be talking a lot about on the campaign trail and already are talking about.
Well, Victoria, maybe continuing in this area for a moment, you've written about the House Republicans' agenda called the Commitment to America. It sounds vaguely reminiscent of the 1990s, but it includes wording about personalized care, personalized healthcare, and lower prices through transparency, choice, and competition, all of which sounds like words and phrases very carefully chosen. What are the Republicans trying to communicate about their philosophy with this, and what might we see coming as a result of that?
Yeah, the Commitment to America was released a couple weeks ago, and honestly, kind of vague on health policy priorities. And I think that's perhaps purposeful. I think that Republicans, I have talked to them in the halls of Congress, asked them, House Republicans specifically, what they want to do about the IRA. And they say they want to amend it or overturn it. They do not like it. They do not like these drug pricing provisions. They say, which is a classic argument, they often say it reduces innovation and that competition is the best way to reduce drug prices. So, but the Commitment to America does not explicitly say that overturning the IRA or amending the IRA is a priority. And I think that's because Medicare negotiating drug prices has strong bipartisan support. If you look at the polling of the American public, consistently over time, both Democrats and Republicans support this. And so I think they do not want to advertise that this is a priority right before the midterms when it's overwhelmingly pretty popular with the American people. But we do know that it's something that they are thinking about. I know they're strategizing about it already. And so it's definitely something to watch if the Republicans do take over the House and potentially the Senate.
We recognize that COVID was such a big issue 2 years ago in the presidential election, but now it's barely getting political coverage. Cheryl, you did write about President Biden's statement that the pandemic is over, but you noted it received lots of pushback from victims' families and public health officials. But I'm wondering if it rang true for the general body politic. But from a policy perspective, is COVID over? Do you expect you'll be reporting on it as much as you have been in the past?
So a couple of thoughts on that. First of all, yes, his comments did rankle a lot of family members and people who are grieving, but also, yes, they did ring true with a lot of members of the public who have just gone on and who feel as if the pandemic is over. And for the vast majority of the public who are not immunocompromised or suffering from a disease or quite elderly and otherwise vulnerable, they are pretty much going about their lives. I do think we'll be covering COVID for a long time, maybe not as intensely as we have over the past few years, but the fallout from this pandemic is going to be very long term and it's going to be with us for a while. We have people who are suffering from long COVID. We have children who have lost parents. We've got issues of pandemic preparedness and future debates on Capitol Hill about, how to prepare for future pandemics. So I think that from a policy perspective, this pandemic is not over. We're going to be continuing to talk about it. And we also don't know what's coming around the bend, right? We can't predict the future. A lot of experts think that there's a fall surge coming. So I think it is on voters' minds, but maybe not top of mind the way it was, say, a year ago.
Yeah.
Well, Victoria, sort of want to go back to Medicare for a moment. The New Hampshire Senate candidate has actually advocated privatizing Medicare, and the president and others in his party are using this and some other statements to say that the Republicans will put the program on the quote unquote chopping block if they gain power. Is this political rhetoric or a real possibility? Medicare just seems so sacrosanct in so many ways from a voter perspective. What's your thoughts on that?
That's a great question. I think it's more so a convenient political attack at the moment. As far as I know from talking to most Republicans and Republican strategists, it's not a mainstream view within the party. It's some more on the outskirts that are saying things like that. Senator Ron Johnson, among them. But I think Republicans know that it's really embedded in the system and it's popular. People like Medicare. And so I think they're more focused on maybe like, if we're talking about Medicare, like expanding Medicare Advantage options, or that's something they really like, which are, private plans within Medicare. So I don't see that as too much of a reality, but you never know. We'll see what happens depending on the midterm outcomes.
It's long been said that Medicare is the third rail of American politics, and that's for a reason that nobody wants to touch it.
Right.
Something we're all waiting for. But Cheryl, you know Congress so well, and most voters probably overlook the fact that the leadership of important health committees will change if the majority party changes. And the Republicans are promising investigations of Dr. Anthony Fauci, NIH, if they control the gavel. What are they saying they want to accomplish if they get the power? And what do you think they'll achieve if the gavels change?
So Dr. Fauci, as I have written, has become really a lightning rod for Republicans. And
he's retiring.
He's retiring, but he's not going away. Trust me.
That's right.
And just because he's retiring doesn't mean that if Republicans win control of Congress, that they can't subpoena him to come testify. And I would be, frankly, surprised if a longtime public servant like Dr. Fauci ignored a congressional subpoena. They say they want to investigate a lot of things. They are particularly honing in on the origins of the pandemic. They've honed in on Dr. Fauci's finances. I should say that there seems to be nothing amiss about Dr. Fauci's finances. Senator Roger Marshall, a Republican from Kansas, helpfully made Dr. Fauci's portfolio public by putting it on the internet, and there doesn't seem to be anything wrong with it. They want to investigate grants that his institute gave to a institute in Wuhan, China, where the virus began. Mm-hmm. But mostly, I think they want to make a lot of political hay, frankly, out of Dr. Fauci. And if Republicans win control of the Senate, it is quite possible that we will see Senator Rand Paul, Dr. Fauci's biggest nemesis on Capitol Hill, take control of the Senate Health Committee. And I can only imagine what that is going to look like, because the two of them have just gone at it over and over and over again. There is no love lost between them. And on the House side, I'm not sure who would take over the subcommittee, but it's possible it would be that Representative Jim Jordan would be in a position, and he has really also gone after Dr. Fauci and has said, basically, we're going to investigate. And if you look on, Republican leaning like social media sites, or, go out with Republican candidates, they have been talking about Dr. Fauci. At least they certainly were earlier in the year when the Omicron variant was racing through the country and lots of people were getting sick. I haven't been out on the trail lately to see if that's continuing, but we will see a big change in health policy discussions, needless to say, if Republicans take charge.
Well, I take your opinion as pretty wise guidance there. And so a question to both of you, really, if we can stay with this for a minute, when we all wake up on November 9th, or whenever the votes are all counted and considered to be counted, do you think we'll have have a clear picture of where the country is headed on healthcare policy issues, or do you think we will see that the country remains quite split with very different opinions in different states and regions, or really in the middle of a much longer battle over abortion, how we pay for healthcare and other issues?
Do you want me to jump in?
Yeah, please.
I would say,
Victoria, welcome.
I would put a period. I'd put a period in the middle of that sentence and ask on when we wake up, are we going to have a clear picture of where the country is headed? Period. I think we have to worry about, frankly, a lot of things beyond health policy. We're going to have to worry about whether or not people accept the results of the election. If people do accept the results of the election and there's a clear-cut outcome, I suppose we'll have some sense, although, as Victoria mentioned, Republicans don't really have a strong proposal for, say, replacing Obamacare or reducing prescription drug costs. They've been kind of vague about it. In terms of abortion, I think it will be really interesting to see how these ballot initiatives that Victoria has written about will play out, and maybe we'll know more then.
Yeah.
Thank you.
Victoria? I think Cheryl's absolutely right. I think that it also really depends on what happens with the makeup of both chambers of Congress. What if we have a split Congress? What if we have both Republican majority chambers, but then Biden is obviously still has 2 years left in his administration, and so are they just going to be sending things to his desk that he won't sign? I think a lot, just so much is up in the air that I'm not sure we can say, but. Yeah, for the Republican side, if they do take over, at least in the House, there's going to be the investigations. There's going to be the IRA trying to amend that. But past that, I'm not sure there's much specifics. For the Democrat side, I've heard some about wanting to make the ACA subsidies permanent. I'm not sure how much appetite there is for that, but I know it's something that the Ways and Means Committee is definitely thinking about. And then past that, I think implementing the IRA and seeing how, can they go farther with drug pricing? But I think just so much is up in the air that I'm hearing, I've been trying to talk to what are you guys planning for the future? And it feels like they're all just kind of waiting to see what happens. So.
Yeah, let me pull the thread on that, because I think 2 months ago, nobody thought the Democrats had a chance at all, right? There's sort of been a roller coaster. The president notched a number of wins. As you look at it right now, the unfair question, what's your best sense of how this is going to turn out, recognizing that we've just had, gas prices were high, now they're low or lower. They're not a talking point, at least. What's your sense of what the outcome might be, and what are the sort of unknown variables that could pop up? Again, they're unknown, but anything that you see on the horizon that might cause either party something to worry about?
Well, I'm not going to go there and predict. I'd refer you to the Cook Political Report. Just Google it, see what they predict. But in terms of unknowns on the horizon, Ebola is an unknown on the horizon. There's an Ebola outbreak in Uganda. It's a strain. I don't want to scare people, but it's a strain that is not responsive to vaccines. And if that comes over here, especially coupled with the monkeypox outbreak, which we haven't talked about, which seems to be kind of in a steady state now, not out of hand. If something crazy like that happens, then all eyes will be on the Biden administration and Democrats for how they respond to it. And we might not be talking so much about other things.
I think a little on the other side. I mean, we saw yesterday that there is something came out about Georgia Republican Senate candidate Herschel Walker about alleging that he paid for an abortion for someone that he had a relationship with. And even though he has said that he is strictly anti-abortion, we're just a couple days into October, and that was an October surprise. I think there potentially could be more that push these really close races one way or the other. This is the time of the year where that happens, and some of these races are just so tight in the Senate, especially the ones that Cheryl talked about earlier in the House as well. And so I think that, we just need to see what happens in the next month, what else might come out.
Well, we will continue to read your wisdom, but I just have one more question, I guess, as we head towards that November 9th and beyond healthcare. The whole issue of climate change and youth and new people coming into voting and exercising their right to vote because of an issue like climate change, which may, with young people especially, cross the Republican Democratic lines. Any thoughts on that? Are you seeing this as a major galvanizing force in the elections this year?
That's a good question. We don't often see a huge turnout among young people in a midterm election. You more often see young people galvanized in a presidential year. Certainly when Barack Obama ran for president, we saw lots and lots of young people coming to the polls. But climate change is a galvanizing issue for young people. It's something that they are really passionate about. And I think it is bringing more and more of them into electoral politics and thinking more about, how politicians and policymakers can affect their lives. A lot of them are worried that the world won't be around, or not in its current form, or it'll be inhabitable by the time they get older. So I do think going forward, we're going to see a real force of young people talking about climate change, getting politically involved because of it. I'm not sure it'll be that big a factor in these elections next month, though.
Right. Yeah, I was just pulling up the polling right before we were chatting, and climate change is one of the issues that's much lower down if you look at the top issues for voters in this coming midterms. So it's below the economy, it's below abortion, it's below even some healthcare things. So I'm not sure it's as much of a motivator, though I do wonder if Hurricane Ian could push it a little more to the forefront, just because if you look at these photos of Florida, it's devastating, and it's pretty clear that climate change contributed to how bad this storm was, and that it was worse than other storms that we've seen before. And so I do wonder if that will play a role. Maybe it will have receded in our public consciousness by the time we get to November, but it's something that the state of Florida is going to still be dealing with, and some of these other states that were hit as well. And so perhaps it could play some role, but we'll see.
Maybe to share with us sort of the last question of what are you incubating as a story, maybe not between now and the election, but what's on your mind as you sort of think about news and things that you're particularly focused in on?
Well, I'm interested certainly in the infectious disease threats that we have before us. So is COVID going to make a resurgence? If so, what's the administration going to do, given that Congress hasn't given it any money to fight the pandemic and it's not going to? Will monkeypox be steady stasis? Will we have this outbreak spread from Uganda? And again, the abortion rights issue is more than an election issue. It's an issue of people's lives. And, I've written about a doctor who helped a 10-year-old girl who was raped and got pregnant by her rape. This doctor helped her get an abortion and is now under investigation in Indiana. So, we're going to see things playing out, the consequences of these and other decisions playing out in people's lives. And that's what I'm interested in watching.
Yeah, I agree. And I think it'll be really interesting to see, depending on what happens with these referendums on the ballot, it's just going to contribute more to this patchwork of abortion policies across the U.S. And what does that mean for us as a country? What does that mean for people in those states? How are they going to move around to access abortion? We're so early in this post-Dobbs climate. And I think there's so much more to be seen. Something else I'm also really interested in is the data privacy aspect around abortion. And as you guys are probably familiar, it's something that people are talking about was data from your phone could be used to prosecute you for an abortion if you're in a state where abortion is illegal or restricted. And we've seen some cases where those messages or data from your period tracking app could be used against you. And I think we're just going to see more of these cases, like Cheryl was saying, of different aspects of the ramifications of DOPS. So definitely something to watch. And of course, I am curious about what the policy priorities will be for this new Congress, depending on what happens with the midterms, as we've been discussing this whole time. And so that's something I'm following, as well as the leadership who will take charge of these key health committees and how will that play into what the priorities are.
Well, we're going to have some long nights in November as all this plays out. Cheryl Gay Stolberg with the New York Times and Victoria Knight with Axios, we want to thank you so much for being with us and for your insights. We'll be reading and learning more from your reporting in the following weeks, as we always do. And thank you to our audience for joining us. You can learn more about Conversations on Healthcare and sign up for more information at chcradio.com. Thank you both so much for the work that you do and for being with us.
Thank you.
Yeah, thank you for having me.